At some point or another, I'm sure everyone's had experience with dissociation. Most often, people experience mild forms of dissociation. This can be something like daydreaming or what's referred to as highway hypnosis. I know for me, highway hypnosis is very common. Most of the time when I'm driving, I'll get to where I'm going and then not really have any idea about anything along the way as I passed it. But unfortunately, for 1% of the population, their dissociation is more severe. I'd like to talk about dissociative identity disorder, which used to be referred to as multiple personality disorder, but it's now referred to as dissociative identity disorder. This involves a disconnection between thoughts, memories, feelings, actions, and a sense of self. They often lose touch with their surroundings as well as their idea of who they are. It's most often some sort of defense mechanism for people. Usually, people who suffer from dissociative identity disorder have had some sort of trauma in their life, whether it be they're a victim of a crime, an accident has happened to them, natural disasters, or child abuse, which that's the most common form of trauma that's involved with it is childhood abuse. Um, in order, like, as far as it being a defense mechanism, most people they can't really handle the stress that a situation has given them. So rather than dealing with it like, or I guess suffering through it like most people would, they aren't capable of doing that. So they have their own way of escaping the fear and the pain that is caused upon them. The American Psychiatric Association publishes a book called the Diagnostic and Statistic Manual. This book includes all the criteria to be diagnosed with mental disorders. In order to be diagnosed with dissociative identity disorder, a person has to have a marked disconnection in their sense of self, accompanied by differences in behavior, consciousness, memory, perception, thinking, and motor function. People also have to have loss of memory that's not related to normal forgetfulness, like where did I leave my keys, or simply having difficulty remembering something that happened a long time ago. They often face stress in social situations or at work. Symptoms of this disorder can't be ruled out as the result of mind altering substances such as drugs or a pre existing medical condition. Um, Someone may also not be diagnosed with dissociative identity disorder if their experience is part of an accepted religious or cultural standard. Some like a cultural standard for us, a lot of people have imaginary friends when they're younger. Someone who has or had an imaginary friend when they're younger can't say that they have multiple personalities. Comorbidity is very common in dissociative identity disorder. Comorbidity makes it difficult to diagnose, and it can often be misdiagnosed as another mental illness. What's most commonly diagnosed is schizophrenia, which is different than dissociative identities. Comorbidity means the simultaneous presence of two chronic diseases, and it's most commonly associated with post-traumatic stress disorder, depression, anxiety, personality disorders, substance abuse, eating disorders, and usually leads to an increased risk of at-risk behaviors. An individual who is diagnosed as having dissociative identity disorder is commonly known as the host. Their other personalities are referred to as alters. I included a photo here. It's from a TV show called United States of Tara, which depicts a woman who has four alters. So I used the arrows to show who Tara is and then who each of her alters are. There's no set limit on the number of alters that someone can have. Each alter can have different identifying features. As you can see in the photo, one of Tara's alters is a male. They can also have different preferences and abilities, as well as certain medical conditions that may apply to some alters and not others. I remember reading in high school that it's common for alters to have different medical conditions. One alter may have a need for glasses where the host doesn't need glasses. Treatment for dissociative identity disorder is kind of intense, I would assume most people would say. There's a 3-phase psychotherapy. Each phase consists of doing something different. Phase 1 is focused on establishing safety. Phase 2 works on confronting traumatic experiences. Phase 3 deals with integration and rehabilitation. What they mean by integration is it's not only important to, the goal isn't to get rid of the alters that someone may have. The goal is to integrate them within themselves, which can help someone have a better idea of who they are, and then they learn to more or less accept the alters for who they are. There's also drug therapy. Most common drugs used are antidepressants, such as sertraline, citalopram, and fluoxetine. A little more about the psychotherapy. Phase 1 focuses on establishing safety and stabilization and symptom reduction. A big part of this is maintaining personal safety. People with this disorder are at high risk for suicidal behavior. 67% of patients have reported suicide attempts, and 42% have reported some history of self-harm, according to the guidelines for treating dissociative identity disorder. It also involves helping patients to control their symptoms, build stress tolerance. The transition between hosts and alters usually occurs at times of high stress, so learning how to better handle stress is important for them. It's important to enhance basic life functioning as well as build and improve relationship capacities. Phase 2 focuses on confronting, working through, and integrating traumatic memories. Effective work involves remembering, tolerating, processing, and integrating overwhelming past events. This is done by a technique called abreaction, which is the expression and release of previously repressed emotion, which is usually attained through hypnosis or some sort of suggestion by the therapist. And phase 3 is focused on integration and rehabilitation. As I stated before, the goal of treatment isn't to get rid of alter personalities. The goal is more to integrate these personalities within the host personality so that they can function properly. Integration is about teaching the patient to be able to integrate the alters into themselves, which also improves the patient's sense of self as a whole. As I stated before, dissociative identity disorder is extremely rare. It accounts for 1% of the population, and according to Mayo Clinic, they have fewer than 200,000 cases per year. Dissociative identity disorder is also not curable. People can improve greatly by having treatment, whether that be drug therapy or psychotherapy, but no matter how well they may learn to integrate their personalities, it is not going to go away. Someone will suffer from it always. But people who have this disorder can, as long as they're treated, can live normal, happy lives. And most people probably wouldn't be able to tell that something was affecting themselves or something like that.